welcome to ANF Academy's live event. My name is Thea and I will be your host today. Before we start, I would like to say thank you for joining us. We know the timing is not great and very suitable for everyone, but this was the only available slot we had for this event. So thank you for making the effort and joining us on this journey. I would like to say a couple of sentences, what you can expect to see in this event. After me, Dr. Mikel will take over and he will introduce you into the world of neurological frequencies and ANF therapy. And then he will go and start the treatment itself. So the important note today, we will treat two patients that we never treated before. They never tried ANF therapy. So this is very special occasion and you have the opportunity to be behind the scenes of ANF therapy session. There won't be Q&A at the end. So if you have any questions during the event, please share your thoughts in the chat box and in the Q&A box, and we will be here to answer. Also, we will provide a link so you can book a call with us if you have any questions, or we will share a link to our WhatsApp group. If you don't like calls and you prefer texting, feel free to join the group and share and send us messages there. Because we value your time, I will stop here and Dr. Mikel can take over.
Hello, everybody, and thank you for joining this live workshop to see the effect of ANF therapy and the ANF neurological medicine devices. I want to show you one man before I start to talk anymore, and he's over here. This is Albert Einstein, and he said, for a couple of hundred years ago, the future of medicine will be frequencies. And now it's here. And I'm really proud and happy to introduce this for you. And I'm going to demonstrate on two patients that I have not seen or examined before. And also going to show you the skills of clinical surgery that we teach here in the ANF Academy and how you can create really good results for your patients. But also to build your own knowledge, your personal knowledge, and values as you, as healthcare and medical professional, to understand the body as a unit by the understanding neurological and biochemical function of the human body, because we need to learn to find the source. So welcome to this and enjoy. So we will move over to the first patient of the day. Hello,
I'm Heinz.
What's your name? Heinz?
Heinz. Yeah.
Heinz. Okay, Heinz. Can you please tell me what's your problem and the story and why you're here? And thank you for coming.
Yeah, thank you. My story is that I had an accident with a water ski, a jet ski. It was 6 weeks ago. I don't remember anymore what happened exactly, but I had high speed. I love speed, so I have a lot of accidents in my life. And this accident was that I fell down from the jet ski in the water. The only thing I remember, I swimming up. And later I have problems with both knees. Go to a clinic, then make the MRI scan, and they explain what happened. Both bands are stretched till the third degree, nearly broken, and now it's liquid inside and inflamed. And if I do this, I don't have pain, but if I do this, rotation, I have a lot of pain and wake up every night because pain go more. This is thing. And 2 weeks ago, I have something strange, tinglings in my fingers, only this hand. It's like it sleeps. This is what my problem is.
Like a numbness, okay. So we're going to check you and find out what your real problem is, because what I will do and what we are also teaching here is to find the problem with the hands, because the things we find on you cannot be seen on an MRI or CAT scan. Okay. So therefore, it's very important to do it properly. The examination is like this. We examine you after the nerve system, so it can be very painful, but I need to find out what's going on. After that, I will apply the devices, and this is neurological devices. So they are actually contain a neurological frequency that is actually sending in a correction signal to your nerve system and create stabilization in the oscillation, so it can actually start biochemical fusions and start to repair. If I find the source, no matter what pain level you have to want to check you, it will go away at minimum 50%. After I apply the devices, I will give you some water And then I will examine you again, and I will increase the pressure in the injury, like 100, 200% more pressure, just to see how much is going away. Because this kind of acute injury, it's always that the immune response create an inflammatory state of the muscle to start the repair and increase the blood flow. If it doesn't go away, now you said it was 6 weeks ago, so that means it can become a chronic thing, means your muscles start to get weaker and weaker, so we need to stop this development.
Yeah. Here, this knee is a little bit better than this one. This one even stay the same. So this looks it go better, but still pain.
Okay. So I need you to remove your shorts, because what is important here is that what you can take it off. What we do is we check everything on the patient, not only where the patient say they have a symptom, because in this case, you have problem with the knees, and that means 34% of all pain we have in the body, you can actually feel in a knee joint. Because what we teach here is to understand the nerve system is a closed system, and it goes everywhere. And through the main joints, you can always feel a symptom, but that is probably not the source. So we will see now if his knee pain is the source, or if it's higher up, because he had this accident, a really bad one. After he doesn't remember the accident, which means he passed out and wake up underwater. So it can be actually anywhere. So we will check this. So if you lie on your back, please. So I will start to check him around the knee and see what I find. The first most important thing is to look, what can I see visually? I can see some vessels and veins here give me an indication of an injury, because also the tissue is damaged. And I cannot see the same here a little bit, and a little bit of color difference. So I will start very gently, because with this we train to feel everything. So we start to feel the muscles like this and search for any kind of damage in the upper and superficial tissue, because if I find the problem already here, and I can feel here that he has an ongoing inflammation, it's edema here, and it's also a little bit of damage in the muscle tendon here. So that means I will go deeper, and already here, this is very, very light pressure, and already here is a lot of pain. So that means we have the tendons here. I need to check his calf as well, because they are also all connected. And I need to go, now I already know he probably have injury up in the adductors and also down in the calf. So we will check everything. But first I check here, because this is the main joint, and it will tell me a lot. So I will continue to check the sartorius. Now I go a little bit deeper, but in between the muscles here. So I follow the nerve and let the nerve tell me where the main problem is over the joint line. And here I can feel the tendon is actually here. The tendon should be flat, firm, nice. It's very swollen. And you can see here, it react with little pressure, a lot of pain. So then I check all the attachments here. And this is very gentle pressure. And here it's even worse. So even when I close back to the hamstring, we actually find, as you can see, he doesn't like this at all. Now we are on the hamstring tendon. So that means his accident was probably that he was landing on the front and then overstretched and flexed it out massively, because now he's not, and this is not deep pressure. But what I need to do here now is I go in between the tendons, because what we teach here is perfection. So I go gently, even if his pain increasing, the body now release adrenaline as well, so it will be not so bad. And now I need to go deeper. So now I'm in to the attachment to the joint itself, and I can feel I have a distance between, in the tendon, it's a cut. So that means it's a quite bad injury. I'm gonna move his leg a little bit, not like this, please. So I'm gonna now loose up the tendons, so I can go in between, and I can hook them. And you can see he doesn't like this also, so I can pull them. So what we teach you guys here is to be perfectionist, to find the source. And you can see it get also very easy bluish, even if the pressure is very little. I go in the joint here. I try to locate the lymph here, because if this lymph is on inflammation too, and it is. So this is a lot of pain here. Now, because I examine and follow the nerve, as you can see on his adductors, they start to compensate. So they swallow up and try to help the injury here. So I will probably find a lot of problems in the adductors and anterior psoas as well. So I do the same. Check the tissue here. And we find another injury. You see, this is just touch. It's no pressure at all. But as soon as I find the source, because I follow the main nerve, I need to check the quality of the muscle. So I go in between. And here is another injury. So this is typical what we see here when on patients, and also when we're teaching, that the patient come with a symptom and they talk about it. When we examine, the main problem is totally different than they think, but also multiple injuries. So here I expect to find, like here I have now already 3 different tendons that is injured, and I have the adductors here also. So I need to follow and see how far down it goes. So as you can see, it's all the way. Then I follow sartorius up to the pelvis, and we have the tendon here. And even that is affected. I check the outcome of psoas, anterior lines here into the attachment. And you see he enjoyed this as well.
Enjoy, yes.
It's nice. So this patient have multiple injuries. So we need to try to help him. And this is what I love with this. All my 30 years since I invented this, to have a tool where I can help the patient in minutes has always been, because the nerve system controls everything in the body. It doesn't matter what the body does, what it happens. If you don't have a nerve system that is working with the perfect oscillation, then you will age, you get sick, you get autoimmune diseases, you get multiple injuries or stress injuries, and this prevents this from happening. And this is why I love this, and it's because you can use it for prevention, and you can use it for acute or chronic injuries with a massive results. And what you will learn here is also to develop a methodology so we don't get any relapses. We have around 98% of our patients that comes with a problem never come back with the same thing. So I'm going to get the devices. I'm going to explain what I'm using. I'm going to use a very, very low frequency. And this is neurological frequencies. This is frequencies, nothing to do with radio frequencies, resonance frequencies, whatever, because these frequencies is making fusions between cells. If that doesn't happen, it can only work with the superficial and stimulate the superficial neurons, which can make you feel a little better for a short time. This is going in the depth. And as you will see after I apply the devices and demonstrate again, remember the pressure I used, and you will see the pressure I will use afterwards. Most important is to keep the patient hydrated, so they drink a lot of water. We gave Heinz water before we started. And just so you guys remember his pain. So we learn in medical school and physio school, we should not do anything to create pain, but to find the source and to be able to help the patient. That's why they come to us, is you need to do this. Otherwise, he will not be satisfied or use his money or whatever. So I will start to use anti-inflammatory devices. This one is called P240, it's a low frequency device. And I will start to apply it, in this case, in the lower end of the tendons. Then I will start to apply it on the upper end of the adductors. So I will try to treat all this area before I start to check the backside. So I follow the sartorius here. I put, this is a positive. So this is actually the outgoing frequency. This is the one that creates the collaboration and examine and check what resources do we have present here. But this will never work alone. then I can use it alone, but it can only stimulate very, very few different neurons and absolutely not creating any resources. So we need a return frequency, a frequency that confirm what I want to do. And for that, I use one that is called negative. This one is P minus 9. So this is a negative frequency. So when we talk about the nerve system, you can talk about receptors and all of this. This is actually the one is creating the return frequency. And this is where the magic is happening. So I'm going to follow here one of the nerves here and also the tendons. I put the negative here. I want to cover as big area as possible in this case. And I put this one here where we have sartorius go up. So now we have 2 positive and 2 negative. What happens here? The positive is releasing the active frequency. This is the one that do everything. So to explain how this works, when you have a patient with phantom pain, for example, it's when the outgoing frequency is sending massively frequencies to try to get the confirmation, everything is okay, don't worry, you can walk. When the return frequency is not there, it will create immune response. It's called inflammatory response and create an active inflammation. That's why these people with amputation feel the pain. So when we treat them, we do exactly the same. Because the nerve system doesn't have a brain. It doesn't understand the leg is gone. So we need to use the negative. So what I do now, now I forgot to tell you, you can see already the swollenness is more or less. Now it's very loose. Is the pain less or the same?
It's less.
Yeah. But
It's still pain.
It's still pain?
Yeah.
Okay. So what I need to do now, I need to apply resources. As you heard on the introduction video, I will use the one we call ADL. This is glutathione. And this is stimulating the frequency for glutathione. So this is actually now I take control over this area and apply a device that is actually moving glutathione here to destroy the free radicals that create the problem. So I'm going to apply that. And this one I apply where I see the swollenness is worse, right here. And normally we say you should wait 10, 15 minutes, fill the patient with water before re-examination. I have very big patients, so I wait 5 seconds. How is it now?
I feel pain, but less.
Less. So this start work now, and then I need to use another antioxidant. In this case, I use carnosine. And carnosine, as you heard on the video, is the body's anabolic natural steroid. This is a massive thing when it comes to cell dividing, renewing cells, remove lactic acid, and then many other features that is happening during the inflammatory state. So I will apply that here because I want the cells to be renewed as fast as possible for the ability to heal the injury. So I'm treating here just a small part of his main injury, and I will also treat the upper part. Then I will use another one that we call MC. This is to remove the stress in the area. So this is actually the exact frequency of medical cannabis to calm down the neurological stress so the other devices can do their work 100% properly. And this one I apply under here. So what is interesting here now, when you work with this, you always need to think, how do I want the frequency to work? So this is working together with this, but this is also working together with the others. So we're creating a lot of triangles here. And now you can see the edema, it was like a little mountain, it's getting less and less. So now he's a little bit scared of my hands. So I'm checking the tissue again in between. Now this is 200% more pressure than before. How does it feel now?
I feel the pressure, but even before I can't handle nothing there.
So you don't feel the same pain?
No.
Okay. If I want, I can be nasty now. I can remove this to see how fast this works. So just for you guys to understand the power of this, I just take this anti-inflammatory off. let the leg rest. I keep the antioxidants, just let it rest. Now you can see the edema comes back. Because now all the BRCA negative lymphocytes is getting active again. And I do this minimal pressure. So you can see I can have control over his life as well. So this is just, I'm just touching. Compare before what I could rub him. So, but I'm a nice guy, so I will put it on again. So I want to, so I put it the same on back again. Because this is actually what is so amazing with this also, as I mean, these devices is for healthcare and medical professionals, and you need to have university degree and you need to have examination to able to enter our school. So to learn how to use it. This looks very, very simple, but it's probably one of the most advanced devices and the only one that can create fusion between cells because the frequency is so different. So I wait, now we pretend it's gone 10 minutes, but it's only 10 seconds. So I will push, are you ready?
Mm-hmm.
Sure?
Yeah.
How is it now?
I don't have really pain.
So this is how it is. But I want him to be really happy, so I'm going to check the doctors. I isolated this injury, but when we want the patient to get really, really much better, we need to think the big picture. And we remember this, and that is a lot of pain. So I will remove these two. So here I will isolate the adductors here. So I put one here. I just follow how they work, two positive. And because I have this here, I can actually use this positive to work with this negative, but I actually want to isolate it because when you have this injury, and he probably twisted, he extended, it being a lot of rotation, I want actually this negative to be right over the other one, because these two negative will not interfere with each other, and they cannot talk to each other because they're same frequency. So that means this is isolated, now I isolate this. I will do the same here. I use the AGL device to remove the free radicals as high up as possible. But here I do it different. I use the neurological anti-stress device in the middle. And then I put in the carnosine, the cell divider and renewer, right over the negative. Then, because we don't have all day, so I cannot wait 10 minutes, so I wait 10 seconds. And we're going to check again. So I'm going to use the knife. Oh, you're afraid of my hand?
Yeah, I'm afraid.
So, as you saw before, I could not really create any pressure. Now,
I don't have pain.
So no pain. So we're going to check the other leg as well, because this one was worse, right?
Yes.
So we're going to do the same here. We start with, because here we can see, I don't know if you can see on camera, that you have vessels and veins here that actually tells me it's an injury here, and which could be the problem. So I'm going to do the same, and this is severe pain as well. Yeah, exactly the same. So now I can, it's also important for us as professionals to try to put the picture in the head, how this accident happened, how did he fall, what happened, he passed out, what happened during that time, to actually understand where to start the examination. So we do the same here. Okay, so here we have tendon that is really, really bad. Same here. So as you can see, with little bit of touch, you cannot lie still really. I will also check around the patella here, so I don't have any development of patella-femoris syndrome. And here is also a little bit crunchy. We check the fat pads here. And this is really painful as well. The patella tendon, I move up and down, and this is also bad. So here is a little bit different. So this explains his pain here is worse than the other leg. And we check underneath here again. Check the lymphatic here. And this is not nice either. So we're going to do the lymph also on the back, both legs, but that we do when we move the patient to the stomach. So I'm going to do for this injury here the same. I put the positives here and one here. So I try to cover all these tendons. I'm going to now also treat this PFS problem here. So I'm going to put the positive right under the patella on the tendon, 50% on and 50% off. I put another one on this side here, positive. So I'm going to do a cross here because I want to hit the frequency under the patella to touch any kind of frequency and inflammation, sorry, that is actually under the cap. I'm going to apply these negatives here. You see, I follow here. Actually, the nerve system after exam tells me everything. So when I examine, it will create contractions so I can actually visually see the injuries. Like here. So I'm going to do the cross over the patella here. And here. Like this. Okay. And then on the PFS here, I'm going to put the anti-stress here, right in the center, because I can feel it's also swollen behind the cap. So it starts to develop a negative thing that can be so developing arthritis or any other main problem later. I do the same here. I use the glutathione here. I use the carnosine for renewing of cells so the tissue can start healing. And this process starts immediately. So this device is active for 72 hours. So during this time, the patient needs to drink a lot of water to stay hydrated. So all of these devices here now do different things in different areas. And this is what is so nice with this also is that we can treat multiple problems at the same time. Okay. So we're going to try this. Are you ready? Now I pressure, my thumb is white. How does it feel?
I feel the pressure, but not really.
Good. We try this here. How is it now?
Yeah, a little pain, but much less.
Not less. And this is in seconds. Eh? It's weird, huh?
Yeah, it's strange.
Okay. I'm going to check his adductor on this side too. So you see, he's not happy here either. So probably he could have landed with a split and stretch all kind of direction with the legs because this injury looks like rotation, stretch, and anterior overstretch. It's actually quite bad. I can see here also that it is some issues. And this is, luckily for him, he's very athletic and trained, so his body's strong. If he wouldn't be that with this accident, he would probably end up in a big casket in the hospital. So I do the same. I isolate the adductors here. Put the negative here. Remove free radicals at the top. Removing the stress in the injury in the center. And then renewing the cells right over the negative. Because if this inflammation that is so bad, I would say this is 9 out of 10, don't go away, don't do anything about it. He will start to compensate and walk weird, he will develop hip problems, probably develop lower back pain, sorry, and other issues, and that can take a year, it can take 6 months, but he will get a lot of problems. Because this is how the body works and compensate for anything. Okay, I will check the adductors again. And now with some more pressure, are you ready? How is it now?
I feel pressure, but not really.
But no pain. It's good. We never let ever a patient go out with that, then they have less than 50% of pain reduction. So if you turn over to your stomach, I would check the backside of your legs.
Thank you.
Yeah. So here I'm looking for if it's any other injuries that is visual for me. I examine here, we have one of our main lymphatic nodes right in the middle of the joint in front of the ACL and everything. So I'm going to check that again. As you can see, it's quite painful. So I'm going to do the same. I'm going to treat that as well. Because for me, it's really, really important that we are perfectionistic, that we think of everything, because this is what healthcare is all about, is to put the patient in the center and be able to explain what's going on. So I put a positive here, right over the joint line, so it doesn't cut, because even if the device is very, very thin, it's still of carbonized metal, and that means it can cut easily. So make sure you don't put it right in the joint. We're going to apply this negative very close over, because I want them to work very close on this area. Because if the lymphatic node here is full of inflammation, that is also helping with the immune response to remove B cells and T cells and NK cells, and actually creating the antibodies for helping healing. If that is on fire, it cannot fix the issue and help the other immune response that we have for healing process. It will prevent it. Because the nerve system, the cardiovascular system, and the lymphatic system, the three musketeers of the human body, is working as one. And they need each other because they cannot live alone. And I do the same on this side. I forgot to tell you guys, you could see before that this was like a big bump, and you can see with visually that it's actually reducing. This is how fast it works. I mean, it's quite amazing. So I'm going to bend, I use my thumb just to show you guys with how much pressure I can put without he jumping, if you remember from before. So, because the body is so amazing, if you don't have any inflammation or pain, it can take a lot. And that's what we're teaching. We can see medical professors that come in here, neurological specialists, physiotherapists, osteopaths, everyone that comes here to do a clinical examination and understand that you can actually go in between and feel and find everything and use your hands. It's gone. I mean, in the old days, it was the only thing you could do. But we use electronic devices because maybe we are lazy, but it's many things you can't see. And this we will also see on the other patient later. That is a typical thing, that when you don't find the source, it can also be a big, big issue for the patient. He had pain by doing rotations. How's this feeling? Not so much? Good. Because this is extreme for your injury, right? And this one?
No pain.
No pain? Good. Okay. I know he had numbness in his arms. I will check his biceps as well. If you sit up, sir. So he complained he got tingling in the arm and numbness, and that can be typical because we have something with the biceps. He probably could have landed on the shoulder, creating inflammation that is swelling up the tendons and preventing the bloodstream in the arm. So we just want to make sure if that's the case. So
I told you I have a hernia here.
Yeah,
on the 7.
Yeah.
So this is always a problem, but this is really new.
Yeah.
Distinctly.
We like the new ones.
Okay.
I'm going to check the herniation too. So we're going to check this here. Very gently here. So you can see I go in between. And when you follow the nerve system, it doesn't matter how tough guy he is and he thinks he can manage pain. it's irresistible. When you have this severe inflammation, the pain is like you get a knife right into it. So this here, I take the same here. This one too. So everything here is compromised. This one too. So I will do the same here. So we will do like this. This is a positive. I use the same devices. We have actually devices that is going extremely high neurological frequency. The mother frequencies, which is I'm still working on to actually find out, is probably around 10 to 30,000 gigahertz. Because if you think of the nerve system, how many branches and different functions, we have not more than 200 different cells in the human body, but we have billions and billions of neurons. Only in the brain, we have 86 billion neurons that is controlling all our functions. And in the body, it's so many, it's not even countable. So 200 different cells, billions of neurons, neurological functions, and resources by the bloodstream and lymphatic stream is creating our body. We need to understand, I put an AGL here too, as I did before, close to the area where the problem is. Glutathione, I'm going to put the carnosine a little bit lower here. And I'm going to put the neurological anti-stress in between. And this is really important to understand that we can today change heart, we can get new kidneys, we can get new hip, knees, everything. But if nerve system shuts down, we are finished. And that's when autoimmune diseases and stuff develop. And this is why this is sending the corrections and keep the oscillation and maximum. I use for myself around 30 discs a day to prevent, to make heart and everything strong, because I don't want to take any risk. I'm 58 now, so if something happens now. So this part here was really painful. So I'm going to increase the pressure.
I feel the pressure, but not really pain.
Yeah. And this is amazing. Now I'm going to check his neck. He complained about the hernia. This is another thing that's important for us as healthcare professionals when they come with a problem, that if you had pain for a long time and you go and compensate like this or like this, and then you take an MRI, it can look like a herniation, it can look like a prolapse, it can look like many different things. But your hands and the nerve system never ever lie. So I'm going to check his neck. So here we look, what can I see? I can see degeneration of sternocleidomastoid. I can see probably a rotation of one vertebra because of the muscle here. So I'm going to do this very simple now, because I have not examined him before. So what I do, I keep a hand here and I put the finger like a saw under the occipital and try to locate the nerve, because they never lie to me. Okay, with the minimum amount of pressure, I can feel the nerve is going in between the tendons. It's a lot of pain. All chronic inflammation starts in the first joint, that is the occipital. And of course, I check the other side too. This side is worse. I keep my hand on the forehead, vertebra by vertebra, and create slightly the pressure. Okay, so here we can see. Now I put my thumb on the side, put pressure here. See, it's solid and stable. But all these small ligaments here can be a problem that creates his pain. Because of that pain, he sit like this and bend his head, move a little bit forward when he's working, like this, creating pressure, and it will look on as an herniation. We go between the tendons, in between to the vertebrae here. I check scalenia here. And you see it's getting worse. I will do a very easy basic protocol that we use here. I'm going to cover the nerve here. I'm going to put the negative here. So I'm going to create this triangle. So this is again the 240 positive, 50% on the skull, And it's very important, and 50% on, because the nerve comes up here, so this is very important. I'm going to do this here on this other side. It's good you follow me with that camera there. You follow my tempo. Like this. Like this. I'm going to put the negative, because I want all the main nerves from the human body that comes out in the whole system, comes from here. It goes here, goes back, and I want to cover that. So I could put the negative in front of scalenia here. And here. I'm going to use the, again, near anti-stress, C7. I want to remove all kind of stress in the body, so it doesn't affect anything negative, so the devices can work properly. I will use the herniated disc here, because it was a little bit pain here. This is a special device, because when we talk about herniation in the disc, it's actually different inflammation from what you have in the tissue. This can be very toxic, high bacterial, and this is why this frequency is very different from others when we talk about anti-inflammatory, because it also have this ability to destroy this. I put the carnosine here to divide the renew cells, and the glutathione to remove the free radicals. And we wait a little bit, and then I will take a hammer and hit his head and see if it's better. Okay. So again, you need to think in the clinic. I recommend you wait 5-10 minutes, give the patient a lot of water. Even more important, if they come to your clinic, ask your secretary or receptionist to fill the patient with water, because the reason I say this, we are living in a frequency field. We have the gravity, the earth, that is negative. We have the top of us that is positive. And in the middle, we have the atmosphere that is getting in the air, that creating a neurological frequency so we can exist. If one of the two stops, we are dead, all of us. And then they need water, because the water contains a very, very, very high frequency that is important for our cells. It's so high terahertz frequency. So now I will do the same, but this time I become a little bit sadistic. I put enormous pressure. And if I did this before, he will not be able to handle that. He will probably start punching me. But it's important, because I'm feeling here after how much has the swollenness go down to 50-60%. I do here. This one was really painful. Now I can keep maximum pressure with my thumb, and I'm not the weak guy, and he doesn't give any kind of pain. All of you is probably thinking, okay, this is awesome, but how long time does it take to actually make him 100%? Everything from 2 weeks to 6 months, because it depends how good the patient is to drink water and eat properly and change the devices every 72 hours. And of course, the better he gets, the stronger device I put on, because I want to go down to the deepest skeletal cell to remove everything. Okay? Are you feeling okay?
I feel okay.
Are you happy now?
Yeah, thank you very much.
You're welcome.
Yeah.
It's been a pleasure to examine you and feel your problems. Yeah. Okay, so I see you again on Monday, yeah?
Yeah.
Oh, what day is it today? Tuesday? Oh, yeah, it's Monday. So we will give you some extra changes that you can bring home, and a protocol, so you can change for yourselves, and I see you on Monday.
Monday?
Yeah, okay?
Thank you.
Yeah. So this was the first patient. Now we have the second patient I want to show you. That is a little bit different problem. So if you please come. You can sit here, sir.
Dr. Mikel, before we start with the next patient, we're trying to fix the chat box is not enabled, so people cannot ask their questions in the chat box. So please, Nick, who is filming right now, can you give me a host option so I can try to fix it?
Huh? Oh, sorry. You can see. Yeah.
They cannot hear me.
You see, so they are sitting on or glue them on or anything.
Yes, I will do.
Try to do
Nick, you can
protocol,
claim
so
host.
just-
I think now it's enabled. Can someone type something in the chat box so we can test it? Yes. Good. Sorry for this. We had some technical issues, but now you can ask all questions you have. So sorry for this.
Okay.
Hey, hola.
Bienvenido.
Gracias.
Yeah, we will try to talk English.
Yeah, no worries.
So, how can I help you? What's your name?
My name is Esteban.
Mhm,
My problem is have a problem on my hip,
mhm,
on the muscle,
mhm,
and I have been visiting 4 doctors. And at the end last year, I got a surgery,
mhm,
a hip surgery. I have a prosthesis right
mhm,
now,
mhm.
but I am still having the same problem, and even worse.
So you went to 4 specialists
Yes.
to get a judgment of your problem.
Yes,
And after 4 specialists, you accepted the surgery, but you still have the problem.
even more, even higher.
Okay. No, but this is, as I told the first patient, that when you look on an MRI, and then you can see some arthritis, you see some cartilage damage, and then of course, when you take that, what we learn in medical school on this person, it need to be a new hip because they don't check anything else.
Problem.
So,
I agree.
do you have any pain when you're walking? Constant pain or?
I have a constant pain.
Mhm.
I can walk perfectly well, but if I walk through a hard surface,
Mhm,
then after half an hour, I have a big pain.
mhm.
Not if I'm walking in a soft surface like a golf course.
Mhm,
I can play golf perfectly well, no problem.
mhm.
I'm also having problems at bed. I mean, sleeping. And probably if I'm sitting in a sofa for a long time, also having
Mhm,
pains.
mhm.
But that's all. It's not a sport problem. It's walking on sitting.
The thing is that when you have this issue, when you're moving a lot, your blood circulation, adrenaline is releasing, and you don't feel pain. When you sit in the sofa or in your car, the muscle go to contraction and resting,
Driving is another big problem.
then comes the pain.
Exactly.
So I will examine you after the nerve system, as I did with the patient before. I will probably go into your hip joint and feel how they did the surgery, and it can be very, very painful. So
Don't
just
worry.
enjoy the pain, but
Don't worry.
hopefully I find your problem, so you will not have the pain afterwards, okay? But I need you to remove your trousers. So this we see quite often, actually, is that patients have a pain problem, and we are using the equipment we have, CAT scan, MRI, whatever, and we work after that. And because of the pressure in the hospitals that they need to fix things very fast, and of course that can create a problem also. If you lie down, sir, on your back, I'm gonna check your prosthesis a little bit, so just try to relax. Yeah, so this is typical prosthesis. Is there no pain here?
No.
Okay. Now comes the fun part. So I'm going to check everything that is associated to his hip joint, because if you still have the pain, because the hip replacement is actually quite easy surgery, is not specially advanced as a knee replacement. So I'm going to start up here, and I start very gently, and already here I can feel we have going to find issues. I'll start with psoas here. So that took a not so long time. So now when I find these swollenness here, and all the tendons associated up even to the abdominal muscle is severe on fire. This is very common. So if they just check this, it will probably save him from a lot of misery. No, this is better. So I go in between here, checking here. Still alive?
Right there.
And this one too. Yeah. So you can see every single muscle here is on fire. So of course, this patient will be definitely recommended to strengthen his muscles to support around it. And I can feel the muscles here is degenerated. It's like if you imagine cellulitis, when you palpate it, it's wobbly, it's not constant, firm and nice, which is of course creating a severe issue. I check as the other all the tendons here. So this is the hamstring. So this is it's not so weird that this guy have a lot of pain, because every main tendon, every main nerve is on fire. I check the ITB on the outside. This is not too bad. I see some bluish here, so I check that too. Check the lymph on the backside. Go in between. Boom. Yeah. So can you lie on this side, please? Here we can see the scar is a standard scar for hip replacement. Open up, remove, and just put the new one in, put it together. A little bit of super glue. No, it doesn't work. So I'm going to check the trochanter area here also.
You are approaching.
Yeah, I'm getting there, right?
Yeah.
So every muscle here is weak. So it's no what we call palpation resistance here. Check go deep into the piriformis here. Move my way down. So you see, I can get in all the way to the prosthesis here and the joint area very, very easy without any kind of using any force. I go in between the muscles here to get all the way into the bone area. Here I even reach the sciatic nerve, but you can see I can play with it here like this. It's a very, very big nerve. It's very easy to find. That is good. Check the glute nerves here. The back side of the attachment. Okay. Can you lie on the back again? I'm going to check one thing that very few is actually observing when it comes to this kind of pain. Is the pelvic floor. I'm going to take a leg here. No, it's good. Okay. Yeah, congratulations to your new hip. So what we find here is actually a severe muscle, but I cannot see 100% what's inside. So I'm going to do a protocol where I actually follow the whole hip joint, and I'm going to do on the outside as well. And hopefully he will feel a lot less pain when I examine him again. I'm going to use the same devices. I'm going to also increase the blood circulation in this area. I didn't do it on the first patient because I want you guys to see the effect without using blood flow and nitric oxide. That is actually increasing the movement of nutrition, RBCs into the area. All of this you know. If you don't know, you know now. Okay, so I follow the hip line. So I put the positive here. If you already forgot his pain, I'm happy to demonstrate it again. It's like this. But he's a Spanish toro, so It's no problem. If it would be Swedish like me, I would run out. Now, don't be afraid to go into the depth. Everything can be examined. It's all about skills and technique, and we will train you to do this in detail. To even if you go to the neurological biochemical higher level education later to feel more or less every organ. And I put like only 3. I will put 4 positive here. You open your legs for me, like this. I'm going to use the negative. So this here, and I put the first one quite close to this one. If you lie on this side for me, please. Yeah. Thank you. So now I need to follow this line. I follow exact how the body is connected, and I try to hit this so it's go here. It's shooting through right now. So always think how you want the frequency to transport through your patient's body. Let me put the last one here. Okay. I'm going to have him do here because of this surgery here. I'm going to do like this one here. I put a positive here, a negative, negative here and negative here. And positive, I'm going to put here and here. Now I'm going to use the AOS. So this one I'm going to use a little bit different. I'm going to use some on the front and some of the back. I'm going to put one here because it soft up the scar post-surgery. And this is amazing with these guys that if you have a patient post-surgery or you're going to do a rehab, that's fine. The quality of the rehab is massive. You can use devices to increase the muscle movement up to 53%. You can remove any kind of post-surgery pain, which means the patients you have can train better and you will get better results. I put ADL here, which is fantastic. I did a demonstration on a 2-week-old ankle joint replacement. And we applied the device. It was actually in Croatia. And he will start running around, walking around without his scratches after 2 weeks. And his orthopedic surgeon was there and watching. He said, "My God, what are you doing?" But this, imagine that when you have your patients and they can train properly without pain, you can remove the only thing that prevents them from doing a good rehabilitation is pain. And you can do that or give people back. This is the neurological antistress, and give them the life back. It's for me, that salary, this is why I choose this line of work. I'm going to have this one was here, anti-stress there. Okay, now I'm going to put the blood flow and nitric oxide. Where did I put them? Yes. I put them here. This is the device that increased the circulation, but the frequency of this is not only, it's also helping to contract muscle. So it's helping the muscle to contract easier and to move the blood better. So that's why it's called blood flow. So, and it's also creating the frequency to collaboration with heart and everything. So I follow the main aorta here on the back. So I go all the way up to the spine here, over the area with the blood flow. The nitric oxide, which is a gas that comes from enos. And this is the reason that we also can prevent any kind of stroke or anything. Because if we don't have nitric oxide, the vasodilation of vessels and veins will not perform as it should be doing. And that means they're getting calcificated thinner and thinner and thinner. The risk for cardiac issues is very, very big. It was one guy who got the Nobel Prize because he found out the influence of nitric oxide. And we have different strengths of this. And this is absolutely one of my favorite. And we always use all of them to make sure the patient always get the best. If you turn around, please. So I will do the same here. I will put the blood flow up here. And I put the nitric oxide down here. Then we wait 10 minutes. That is, in my world, going very fast. It's like 1, 2, 3, 10. And then I dig in again. And I find this injury here. So I'm going to now, just to show you the power of a low frequency, and when you have the ability to create fusion between cells, when I put my 104 kilo pressure on, what happens? Normally, he will probably be super scared, or you guys are scared that I will injure or break anything, but the body is so amazing. Of course, I know exactly what to do. So it was here. How is it now? This is the double pressure from before.
No, nothing.
Okay. Now it's 104 kilos.
Okay.
Yeah.
You are there.
Yeah. So we will check again.
No, not really.
Look at this difference now in the mobility from before. And even here, you have at least 10, 15% better angle.
No.
Nothing? Nada.
Yeah.
So you can see now I can become a professional baker to do some bread on his thigh. And this is what is so amazing. Unfortunately, if my colleagues would have learned to use their hands to check all muscles before, because if this was the case, I didn't see his MRI, so maybe it was necessary, but if the pain is still there, if they would check this, and if they would have this tool, he would have a lot of different life. And this is need to be changed, as I said before, after 3 days, and then he need to drink water. All the time the patient go to the toilet, the urination should be clear, because we need the water. Every single device I apply demands a lot of resources. If the body goes out from resources, he can start to feel pain again. If we start increase the water, then the pain will go away. What many patients doesn't realize, when they had pain for a long time, when you remove the active inflammation, the muscle can start working normal, and it start to contract and testing itself all the time. It start to rebuild muscle mass. So a lot of patients comes to me and say, "Hey doc, the pain is much worse now." And I say, "Oh, is it the same pain or does it feel different?" "No, it's different, much worse." So they actually got training pain, because a chronic inflammatory muscle cannot work properly. So it cannot work, extend, and contract as it should be doing. When you remove the inflammation, it do that. It contracts and it start to work, create lactic acid and many other things it done for a long time, and give them a lot of training pain. And this is how ANF therapy works. I hope you like this. I want to show you a little bit of a sketch how this is working. How do you feel? Okay?
Very well.
It's good?
Very well.
Yeah, I will continue to fix you if you want. So thank you for coming, and don't forget water.
Don't worry.
Just make sure if we can prepare a change for him, that he can change for himself, or if Helen can do it on Friday. Okay. I will do a short demonstration how this is working. So, as I said before, we have a positive device and we have a negative device. When we have an inflammation, these two in the nerve system, because of the inflammation in the neurological function, cannot communicate and create fusions with all of it. So these red free radicals is getting more and more and more, and we have present antioxidants and other resources, but they cannot actually do anything, because the inflammation that is an immune response is actually here taking over. So the neurofrequency medicine is so unique, because I can demonstrate like this. If you have like a radio frequency, it's more like this. It's very constant. And radio frequencies is very good for us. It can affect our mood, we can feel better, and all of these, happy or sad, but it cannot do anything here. Resonance frequencies is exactly what it is, what we use for MRI, CAT scan. It can reflect. And from that reflection, it can create an image. But it cannot do any neurological frequency. So what is the difference? To be able to do these, the biochemical action, we need to have an outgoing frequency. This outgoing is coming from the plus device. And it goes like this and connect all the different cells here and checking what do we have here, what is going on, and it goes to the negative. This negative device now is sending a return frequency to the positive and saying, okay, this is going on, and this is much, much faster. This is 1 million times faster than this one that's checking. What happens then is that now the positive is changing again. Now we apply the antioxidants, the glutathione and carnosines, and now it will go like this to the negative. And here it changed. Now the antioxidants is present. It starts to neutralize the inflammation. And now the negative change again. Even faster, but bigger. And this is why this creating the biochemical fusion that gives this result, as you saw today, on live patients with extreme a lot of chronic pain and acute injuries. If this didn't happen, we wouldn't have that result. And it's so amazing to have a tool where I can show you, or any of my colleagues or students around the world, the effect of this in minutes. And it's immediate. And then we have 600 different devices for different depth, different problems, different pathologies to help different patients. I hope you enjoyed this, and I really did, and I hope to do this again. Another patient? Of course I am. I'm very happy to see that. We have another patient. Okay. Speak English? Nice to meet you.
Nice to meet
Mikel.
you, Pilar.
Encantado.
Nice to
Pilar.
meet you.
So how can I help you, Pilar?
Yeah, 4 years before I was operated a cancer here.
Ah.
Then 6 months ago, my foot started to
Swallow up.
exactly because the lymphatic system doesn't work.
Ah.
Then I have a problem in my foot, in my knees, because
Mhm.
always is inflammation.
Okay. So your post-cancer surgery in your leg.
Yeah.
And was it lymphatic in the cancer or was it in the muscle?
The lymphatic system doesn't work now.
No, but it worked before, so they cut it out, or
The doctor told me it's bad luck. It's not
bad luck.
bad luck.
Okay. Okay. If you
Because,
lie down, please. I will
Twice
take-
the operation,
Mhm.
the knees,
Mhm.
and now the foot. Now,
Okay. Yeah, because it's all connected.
yeah,
You
exactly.
have pain when you walk?
No pain. Well, in my knees, yes, because yeah, I play paddle. Then the inflammation.
You play paddle. It's good.
Very well.
Very good.
With
You play with Sunnis too?
exactly.
Ah.
And Sunny is better than me, of course.
Okay. Don't tell her that. If you lie down,
I
please.
think okay.
I'm gonna move around here. So
Now it's very well because
Yeah.
in the morning, know how heal is
no,
correct.
okay. So I will check you after your nerve system because I can see the surgery they did here, so I can actually more or less know what they did. So I will check you after the nerve system. But you feel most pain in the knee and in your feet.
More pain.
No, when you have pain, it's
Okay.
mostly in the knee and here. El dolor es más aquí and
Sí,
ahí.
sí, aquí. Dolor
Okay.
aquí. Because
¿Preparado?
sí, of course.
Okay. So I'm gonna start
Yeah,
here.
it's correct here.
Yeah, fine.
Okay. Oh. Oh, duele, ¿eh?
I know. No.
Duele.
So we have already more or less find the problem. I don't know how many hundreds of knee patients that come with severe knee pain. And I just checked the lymphatic node behind the knee and kaboom. Because when she tell me, I will also check for anything else, of course, but this swallow up, a leg swallow up, that means the lymphatic function for removing the lymph is not there. I can tell you guys immediately, this lymphatic massage, drainage, or whatever, doesn't work because you need a biochemical action and function together with the nerve system and the cardiovascular system to make the lymph system work. The lymph system can only work the lymph together with muscle contractions and muscle movement, but these need to be 1,000,000% synchronized with the nerve system and the cardio system. Otherwise, nothing will happen. Because as you can see, she looks good, she's still alive, and she moves a lot. She plays paddle, she's an active paddle player. And that means she moves a lot and uses her muscle a lot, but she still have the main issue. And I will check the knee as well, of course. I start with the lateral side, the ITB is okay. This is actually water. And I know if she play paddle, and I know play myself 8 to 10 hours a week, then I know her movement. So if she can move like that, I don't expect to find any mechanical issues. And I don't either, as you know, this is very common here, the rotation, sartorius. Check over the scar. Is this cool? Yeah, the scar is painful.
Yes. Oh.
Yeah, this one. So this is where
yeah.
the surgery was.
Yeah. What is your name? Remember me again.
So we find two problems here. So this, because they cut a bit of the muscles, of course, this is pain. So we will remove these two. Okay. So I start with this, okay? Are you okay? Now you know my hands.
5 seconds.
Well, yeah. She liked me very much. This is also the good thing with this you get a lot of hugs and a lot of punches. But remember this pain, huh?
No, I remember your name forever.
Good. So I will same as him because of the surgery, because they actually cut off a big part of the muscle. So she can't really extend normally here because when she's playing, this inflammation gets very constant. So I'm going to remove this. I'm going to put similar protocol as I did on the gentleman before because it's quite similar. Follow the scar. That was positive. I'm going to put the positive on the back lymph here. I'm going to do the negative. Now she's probably going to play better than Sanne. So if you compete against each other, she will probably kill.
She plays very well. As she's so strong.
She will play better if she moves better. I used glutathione, and here, because of the surgery, I actually checking where it start to get worse. So we are here, but now these devices I put start to actually work. So the pain is a lot less. It's much more fun when the patient jumping up and down. I always say to the patient that I have all the fun now when I check you. After I find your source and I apply the devices, you have fun because you will not feel the pain. And the first thing I always hear then is, you don't push as hard before. I never push hard, but I know exactly where to go, which is a big difference. I put the carnosine here to renew. And I put, in this case, I put anti-stress here because this here, because of the surgery, is also under a lot of stress. I'm going to have a -9 on the lymph behind her knee, as I demonstrated before. Lift your leg here. Like this. Okay. And we wait my famous 10 minutes. Are you ready? Sure? You will remember me, huh? You promise?
Yeah.
So every time I see you in the club, it was him. Okay, you ready?
Yes.
This is the pressure from before.
No, now I'm better.
You better?
Yeah, now I'm better.
And you all can see the difference how deep I am now. Now it's 200% more.
I can resist now because before was awful.
And now it's 300%.
Oof,
400. 500.
500.
Is it okay?
So, bueno, I can feel it.
Okay. Now I do as before. I take them off again. I like you, but and we wait my famous 10 minutes. Now I guess it starts sweating here. You ready? Sure.
Oof.
Oh. Because now I took them off. So now you can see the difference with this. Just little bit how much pain she has. So now I have her life too. So now I will put them on again. Like this. Like this. Follow the muscle line, the negative. The negative. I will remove this water here also. There's a lot of liquid.
So fun.
Mm-hmm.
It's better.
Okay, you ready?
Oof, ready.
Feel okay?
Feel okay.
You trust me?
Mm-hmm.
I wouldn't. Okay, so this is the pressure from before?
Better.
200%?
200.
300%? Still
300.
lying still?
Yeah.
400%?
I can resist.
500? And
500.
all of you can see my finger in her injury. 600%?
I can resist. Now
7?
I can feel it.
Yeah. Do you want me to take them off again?
More? No.
Okay. If you give me a positive and negative here, I'm gonna remove this liquid here.
Oh, complete.
So I put the positive here. I put the negative here. And in this case, I'm going to use the energy device also because because you have the surgery and actually removed a bit of the muscle, I want this to move better. So I'm going to use here the energy. This is energy. This is increasing the movement in up to 53%. And any professional athlete knows if I can increase the muscle length, it will take double as long time. With this one, 3-4 times longer before my muscle gets fatigued. But also, if I can increase this length of the muscle, it means I prevent it from stress injury. I use this every time I play padel, and I play a lot. And everyone, what is this? Stickers. And I tell her, if you would know, you would use them too, but I don't tell them. So I wanted to remove this and increase the length of this muscle. And because I will put here now the one negative, no, I want to extend it from down to up. So I put the negative up. That was the plus, sorry. Put the plus down and then negative up. So I want this plus to send to the negative and this confirm and increase the length from this, from down to up instead of from up to down. Because the stress is here. Now the device has been on for some minutes.
Oh. Oh. Ah. Ah.
This is a different injury.
Oh, qué dolor.
Yeah.
Oh.
So this is the hamstring. So now I need to go on your stomach. La vuelta. Poco abajo. Tum, 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 tum.
Oh.
Yeah. Okay. Now, so that was one problem. Now we're going to check the hamstring.
Oh.
And you can see, as I said before, it's really important to check everything. Okay, so we're going to use this here too, if we have 240. because you can never, ever only have one injury. You need to check everything, because if you have one injury here in surgery, all of this need to compensate, and that can create secondary injuries. And this is the reason we see many doctors and therapists that do our education when they come here for practice training. This is positive. Okay. Is that they fix the main problem, but they don't check the secondary and third problem. So I do like this here. Do like this here. If I have blood flow nitric oxide, please. Better.
Better.
It was much more fun when we were jumping. So I want to increase the blood circulation in the hole here, so I put the blood flow here. And the nitric oxide I put below, because I want to have the vasodilation be as strong as possible, because always problem to move the blood back up. And I want that to have an easy flow. Okay. How is it now?
Better.
Better?
Mm-hmm.
Much better.
Much better.
Check the lymph. Okay. It's very important, Pilar, that you keep the inflammation away from here, because when you have this surgery and also that you have active inflammation in the lymphatic system, you need to come and check this regularly, because if that becomes chronic, it will spread to your whole immune system.
Is chronic now or not?
Not so bad,
Not so bad.
more the muscles, but this inflammation can go to your whole lymphatic system, and that will affect your immune system, and then you can get other problems.
There is on the foot now.
See, now I will check the foot as well. So
Same.
now I will check the foot, because you are you ready?
Yeah.
So we check the plantage first. Actually, this is no problem. This is good. Check the Achilles. I suspect we're gonna find a problem in the calf. Not really. So this is also better. Can you turn around? Boca abajo. Boca arriba, yeah.
Muy bien.
So we check everything here. You see, it's very easy to go in between every tendon. And here we teach people to check every bone, every ligament, everything. Because when you do what we call clinical surgery with your hands, you need to be very detailed and practice your fingers to feel everything, like you have removed the skin and you see what's underneath. You know exactly where to go. I mean, this is over 30 years experience, so I don't expect anyone to do the same. But the more you practice, the better you get. And most of all, you learn how the different parts in the body is going to feel like when they're good or not. Of course, everyone can be different, but now you can also see the water here is getting less. Also because the skin is getting more sloppy. Not all women is happy for that. Okay. Stand up and see how it feels.
I'm surprised.
Oh, a surprise.
I'm surprised. I'm surprised. Yeah.
Huh?
I'm surprised.
It's very important you drink water.
2 liters?
No, you like 1 bottle of water per hour. Every time you go to toilet, the urine need to be clear, because I see you don't drink too much water.
Yeah.
And you must, because every one of these devices demands a lot of resources. So when you play, because they cut your muscle here, and this means you have no strength here. So you need to build up strength here to get this stronger, even if you had the surgery, because this need to be, squeeze your muscle.
Muscle, ¿no?
No, squeeze. Contract.
Contraemos.
Contraemos.
Contraer, sí, sí, sí.
No, tú, y ahora.
Ahora, así.
Sí, mira. It's no fuerte. There's no support to your knee. So, and because here, when they cut here, actually the muscle activity here is less. So the support to your knee is very weak. So you can use this energy device, but most of all, if you train this really, really good, and we can tell you exactly how to do this, and this, so you create stability. Like mine, this is a full prosthesis. It's cut here and here. You see this muscle here. Normally, it's impossible. But I trained really, really hard after I got this when I was 35.
This muscle, I have to train this muscle.
No, these ones here. Everything here and the quad, the backside.
Mm.
Every single muscle around the knee need to be strong. Okay. So
Alright.
we can see that now it's different. And this is why I love it. And people get so surprised to see the effect of this and how fast it works. And of course, this only works when you find the source in the problem. If you put this on a patient that is perfect, you will have no effect. Of course, you don't have effect on something that's perfect. So people are, how long time does it take? It depends on how long time it takes for the nerve system to learn to copy these frequencies and make them a main frequency of the human body. Because when that is happening, this problem is gone. And this is why it's so amazing to work with something that creates fusion between cells and resources in the human body. Otherwise, this will never, ever happen. Again, thank you, Pilar, for coming.
No, thank you. Thank you
Yeah.
for all.
No problem.
I'm very surprised.
No, it's good. Yeah.
Very surprised, yes.
And this is what is amazing with therapy, because here with us and all our thousands we educate around the world, we get cases that have more or less giving up. They have severe problems. They tried everything. They've been everywhere. And so they have all these negative and skepticism in the head, but we are the last thing. Oh, I go and try and see what happens. And they come here. Like she said, I'm very surprised because she had this for a long time. And to see that happiness in people's face, and this is what's creating ANF, is from mouth to mouth, nothing else. Because this is a live research, what you have seen. You can read about many, many things and science here, but the only thing that matters is that your patients get better. Reading doesn't do anything. Action, activity, and results do everything. Thank you for watching and hope to see you all in our education.